Your Health today. We're talking about wrinkles and how to get rid of them, and not just any wrinkles, the ones on our hands and chest. And this is especially timely as it starts to get much warmer here in San Diego. Joining us to talk about it is Dr. Sabrina Fabi. Dr. Fabi, you don't have any wrinkles.
I know, because this stuff works.
Yeah. But you are going to talk to us about it, and a cool procedure that has been shown pretty successfully to get rid of some of the wrinkles. Talk to me about what's going on here and how really the sun plays a big role in all this.
Well, we're really excited because we were part of the 2 studies that were responsible for both of these FDA indications that have just come about. The first one being Ultherapy was actually just approved last June, and it's ultrasound energy that's able to stimulate new collagen production, which the sun is primarily responsible for breaking down. And it stimulates new collagen to improve fine lines and wrinkles of the chest. So what we're recognizing is that it's beyond just the face and the neck. People are recognizing that the chest and the hands are also giving away their age. And so if your face looks perfect, but your neck, your chest, and your hands don't match, then it kind of is a giveaway.
Yeah, and you mentioned this new procedure, this Ultherapy, just approved by the FDA. And this is really huge because you mentioned just, for example, moisturizers and wearing sunscreen. That's not enough, really.
It's going to prevent further damage, which is very important, especially living here in Southern California, where 50% of your damage is actually in the car from UVA rays, even if you have sunblock on. But it's not going to actually retard any of the changes that have already happened. And so you need to do something to stimulate those cells that are no longer creating collagen.
Dr. Fabi, is this procedure, and I want to show some video because we show some comparisons of before we have the procedure versus after, and there's a remarkable difference. That's post 1 month on the right side of your screen there, seeing the lack of wrinkles. So once we get this procedure done, is it something, one, that we continue having to do? And do you recommend other things like continued sunscreen wearing, for example, maybe wearing gloves while you're driving? You mentioned that's a big one.
Right, and so, well, this procedure is also now another injectable that was just FDA approved a week ago called Radiesse for the hands. And so this is an injectable procedure, and what you're seeing is after just one treatment, the significant improvement in the hands, because with age, you start to see the tendons and the veins, and when you're injecting just a 5-minute procedure, a little product that can last, honestly, up to a year in some studies, you can see the improvement, not just in the tendons and the veins, but also the wrinkles, because women come in complaining of crepiness, but it's really the volume loss in the hands that's causing these changes. The same in the chest. With a single procedure, again, no downtime, takes 20 minutes with Ultherapy, you can get significant improvement in fine lines and wrinkles with no downtime.
Do you have, you mentioned both of the Ultherapy and then as well as the injectable. Are there certain patients that are better for one type of procedure than the other? Say if you have really, really deep wrinkles, which one you would recommend?
Right, so for the chest, there's really no contraindication unless you're pregnant, but otherwise it's shown effective in patients as old as 80 and as young as 21, so it really doesn't matter. Patients can, with signs of wrinkles and aging, can benefit from it. As far as the hands, the same. It really doesn't matter. Now, if your hands are a little further gone, you may need 2 syringes as opposed to 1, but otherwise there's really no contraindication. You obviously have an increased risk of a bruise if you're on some blood thinners.
Yeah, well, I definitely know, even myself, when I drive, I'm like, oh man, I should probably put sunscreen on my hands because we get so much of that UV rays. Dr. Fabi, thanks so much for your time.
Thanks so much for having me, Jen.